Hi there, and welcome to the 3D Integrated Medical Stem Cell Talk. I'm Dr. Trom, and today I'm going to go over a really interesting article I found out of the International Journal of Orthopedics, published in 2014, specifically going over rotator cuff repair surgery and the use of stem cells to accelerate the healing. Now, for anybody that's over the age of 40, you should by now know that we get shoulder pain, and it is usually the result of something wrong with the rotator cuff. Severity is really what dictates whether or not we need surgery. In my case, I'm 53 years old, and I have now had two. 3 years ago, I had my right shoulder repaired, and that was a martial arts injury. Just recently, I had my left shoulder repaired, and that was from a work-related injury. I'm 5 weeks post-op, and based on what I read in this article, I decided to have amniotic fluid put into the repair surfaces before the surgeon closed me up. But before I tell you about the results of that, let's review this article a little bit. So as we know, surgeries are very common. And worse, post-operative re-tears are common at 25% of surgeries. This poses a huge problem. Secondarily, within a year, re-tears range between 15% and 45%, which is another huge problem. The shoulder is a very dynamic joint, it's rather fragile, and if people don't take care of it, they can cause further injury. So the purpose of this study was to utilize bone marrow derived stem cells to accelerate healing and to see if they would last longer, if the repair would be stronger. The interesting thing about the results were that not that they were just impressive, but the speed with which they were impressive. What they found out of 90 participants, 45 of which were subjects of the study, and another 45 were a control group who did not receive any stem cells. What they found was, what mattered was the amount of stem cells given. If there were more than 30,000 stem cells injected at the site of injury, these patients had a 2 centimeter squared repair area within 3 months. If they had less than 30,000 stem cells, patients had a 2 centimeter squared repair area within 4 months. That's still pretty impressive. Now, in the control group, people who had no stem cells, they needed 6 full months to start approaching the 2 centimeter square repair that they could identify on ultrasound. That's impressive. That's twice as much healing in half the time. Now, what we found also in this study was the prevalence of re-tears after 10 years. What happened was that the people that had the stem cell had so much more regrowth at the site of repair that after 10 years, more than 87% of them still had intact, strong rotator cuff repairs. However, in the control group, after 10 years, only 44% of them had the same intact surface that had been repaired. That's over nearly twice as much improved longevity of the repair site. So in my case, I did not have amniotic fluid put in my right shoulder. I didn't even know about amniotic fluid at that time. So I did have a great surgeon. So far I've got a great outcome on that shoulder. And I'm taking care of that shoulder with continued rehab and caution, no more martial arts. And I'm hoping that I keep that rotator cuff repair for the rest of my life. Now on my second repair here on my left shoulder, I can already feel after 5 weeks post-op that repair is holding and intact. I'm moving it far greater than I was with this arm at this point in time. It still has its frozen shoulder component that comes with all rotator cuff surgeries, and that's a tough one to get over, but you just push it through your rehab. But what I'm finding is that after the amniotic fluid injection to the repair sites, I already feel a stronger repair and less discomfort. I'm far more active, even though my surgeon would probably not be too happy with the things I've been doing. So that's an interesting outcome study in the International Journal of Orthopedics, and it's also an interesting outcome for myself personally, something I talk about in my lectures. So feel free to go to our website at 3dintegratedmedical.com sign up for one of the 2 lectures that I give every month. The tabs are down below on the home page. It's a very easy setup. Just click and register for the lecture. We look forward to seeing you there. Have a great day.